Hi, everyone, and welcome to the HealthFlex Wellbeing Program webinar. Thank you for taking the time to join me today. My name is Todd Creviston, and I'm a benefit educator and health promotion manager at Wespath. And today, we're going to cover the majority of the HealthFlex Wellbeing programs and what they have available for you as far as a resource goes. And we'll also cover what they offer incentive-wise. That would be Pulse Cash. And we'll get into all of that in a few minutes. So to begin with, what aspect of well-being matters to you? And that could be what matters to you right now. And I just put up a couple different bullet points, a couple different concepts or programs. When I look at that, the one that stands out to me first is physical activity. The physical activity one, I think I've got down pretty well. It's a well-worn path. I have a lot of support. My kids like to go to the gym with me. My wife also likes to go to the gym with me. So on the days where I'm like, low motivation, said I don't feel like going to the gym, I have some help in getting me off the couch, into the car, into the gym, or at least off the couch and onto the walking path. A couple other programs would be the emotional well-being. That's really important. It's really come into play since COVID. We'll talk about how that program has been enhanced over the last couple of years. Improving sleep, we're on the precipice of how important sleep is for us. We've got a couple of resources that are going to help with that as well. That's an area that I'm currently working on. This summer, my kids are home from college, so I've got a full house. College kids don't like to go to bed at 10 o'clock at night, so I find myself getting woken up, and I need help in getting back to sleep. There's some resources that I'm going to share with you in a little bit. What I'd like you to remember and take away from this is that bullet point on the bottom. HealthFlex has a well-being program for everyone. There's something there to help you. And we're going to cover all this. And I hope at the conclusion of today, you'll have a great understanding of the well-being program, find some things that excite you, and find some things that you want to go investigate and do more of. And incidentally, you'll be able to answer or ask questions throughout this webinar. I'm hoping to be able to get to the questions at the end. So all you'll need to do is click on the title questions in that go to webinar dashboard. Click on questions, it'll expand it, and then you'll be able to ask your questions. Please make those well-being related questions. If I don't get to answering your question today, I'll actually send you an email with the follow-up answer. We're also recording today, and that'll include a link to the recording. So all of that will take place, get that to you within the next couple of days. So here's the crux of what we're going to cover today. Lots of text, lots of words on the screen, but I wanted to include this slide because it covers there's a nice definition for each of those different programs. The diabetes, heart disease prevention, diabetes management programs, that's offered through a vendor called Omada. Wonderful program. Health coaching is offered through Virgin Pulse. It's another great way to get quality information, empirical, evidence-based information on well-being. You can go to Google or you can go to any web browser and search a health topic and get an enormous amount of feedback and hits from your search terms, but that doesn't mean that all of that information is correct, all of that information is accurate. With the HealthFlex Wellbeing Program, you can be assured that the information you're getting, whether it's from a Virgin Pulse health coach or through the Omada program or EAP, it's quality, evidence-based information. The EAP, the Employee Assistance Program, has been updated the last couple of years. There have been a couple of things added to that, as well as the MD Live Behavioral Health. That was just recently added. Weight Watchers is a tried and true program that's been successful for a lot of people. You'll actually see that advertised on TV. To join it and get that 50% off discount, you'll want to join through HealthFlex. And then two programs that actually have a due date. So the Blueprint for Wellness, you'll need to complete that by August 31st of this year. And then Health Check, you'll need to complete that by August 31st as well. So your best first step is to enroll in Virgin Pulse. everything that we just covered and that I'll cover in the rest of the presentation is accessible through your Virgin Pulse app or the Virgin Pulse desktop. So we'd like everybody to be enrolled in the program. You'll go to that website right there and scroll to the bottom of the web page, click Sign Me Up, and then follow those steps. And those steps are going to the enrollment steps. You'll enter your first name, your last name, date of birth, etc. You'll also set up your own password. Make sure that your password is strong, and also remember that password because you'll need to use that when you download the mobile app. Okay, so now you're enrolled in the program. New enrollees can order a Max Buzz, that's Virgin Pulse's activity tracking device. You'll be able to order that for free. There's actually a credit of $28.99 in every new enrollee's account. And that covers the cost of the Max Buzz. It'll arrive at your home about 7 to 10 business days after you order it. You can also apply that credit to another device. So in the Virgin Pulse store, you'll be able to look at the other devices that are compatible with the program. Devices from Fitbit, devices from Garmin, devices from Polar. All of those are compatible with the program, as well as the Apple Watch. And the Virgin Pulse store sells the Apple Watch as well. So you can apply that credit to the cost of that different device, and then you just pay the difference with a credit card or a debit card. That too then will arrive at your home in 7 to 10 business days after you order it. Now that you're enrolled, you have access to all the HealthFlex well-being programs and incentives. So let's take a look at what that looks like. We like to say there's two ways to engage in the program. The favored way would be the mobile way, because you're able to download the app, put that on your phone, and then you have the Virgin Pulse. I have it up right here. You have that Virgin Pulse program right at your fingertips. So once you've enrolled, go to your respective store, the App Store, whether it's Google or Apple, search for Virgin Pulse. You'll want to look for that Virgin Pulse that looks like in that upper left-hand corner, the red Virgin, the blue Pulse, in that script. Download that, and then enter your email address that you used when you set up the account and the password, and now you're logged in, okay? If you're using the Max Buzz, you'll also need to use the Virgin Pulse app to sync your steps. So in 7 to 10 days, that Max Buzz is going to show up at your house. There's easy to follow instructions to connect that to your phone app so that you could move your data over on your Virgin Pulse account. The other opportunity is to log in web-based. So you could just open up a web browser on a laptop or a desktop and then enter your email address and password and go in and engage in the program. I log in virginpulse.com probably a couple of times a week. There's some things that I like to do from a web-based versus on the app version. So great way to engage in the program is that mobile app. The program is a quarterly program, so it resets to level 0. It resets every participant to level 0 on the first day of each calendar quarter. So this July 1, everybody went to level 0. And then as you earn points, you'll move from level 0 to level 1 when you hit 1,000 points, and you'll earn $5 in Pulse Cash. When you get to 5,000 points, that's level 2, you'll earn $15 in Pulse Cash at level 2. Level 3, that's 10,000 points, you'll earn an additional $10. And you'll see in this diagram, level 4 isn't reached yet. Level 4 is 15,000 points. You'll earn another $10. So you can earn up to $40 per quarter by reaching level 4. If you do that all 4 calendar quarters, you'll earn $160 in Pulse Cash. Pulse Cash is money. Pulse Cash spends just like cash in our pocket or our wallet. You can transfer it to your bank account. You can use it to shop in their store. You can get an electronic gift card to Amazon or Visa. You can also donate that to the charities that they have listed on file, including UMCOR. UMCOR is listed in their charities, which is very cool. You might be looking at that and say, wow, 15,000 points, that's enormous. I don't think I can quite get there. Well, you probably can. You most likely can. And I'm going to say everybody can, because there's an enormous number of ways to earn points. So you don't need to be a marathon runner to reach level 4. You don't have to be training for an Ironman to reach level 4. I'm going to show you how you can get to level 4 by engaging in the program consistently. So if you do some things every single day, you're going to propel yourself to level 4. So here's a couple ways to earn points. The one-time opportunities are at the top. So there's a friends portion under the social connections in the Virgin Pulse app. So it's kind of like Facebook. When you navigate to that spot, you're going to see some people that you might not recognize, because Virgin Pulse will just serve up people, kind of like how Facebook does it. Once you start connecting with people, you'll be able to see friends' friends and connect that way. The really neat thing with the Wespath HealthFlex Virgin Pulse program is that you're able to connect with anyone who's enrolled in the Virgin Pulse HealthFlex Wespath program. So that could be somebody in the Pacific Northwest or Alaska, South Georgia, or anywhere in between, and you just search for them by name. You'll earn 50 points for each friend that you connect with, for a total of 250 points, or for 5 people. Another opportunity, and I've been involved in the Virgin Pulse program since I started in April of 2012. Last week, I finally added a profile picture. I finally found a picture that I thought was worthy of my Virgin Pulse profile. If you're interested in seeing what it looks like, search for me, Todd Creviston, and you'll find me, see my picture, send me a friend request so that we can connect. The other opportunity, that's 100 points, and that'll be available for you when you decide to use it. It's been available for me for 10 years. I finally used it. Other opportunities, and these are very powerful. So these opportunities are daily. So you're able to upload steps each day. Virgin Pulse will give you 10 points for every 1,000 steps that you upload. The max is 14,000 steps, and you'll receive 140 points for that. But I still rely on that statement. You don't need to be a marathon runner to reach level 4, okay? So if you're uploading 7,000 steps per day, that's 70 points per day. 70 times 30 days in a month, that's what, 2,100 points? That's a really good start right there. And for a behavior that is so meaningful and so impactful as walking. Your next opportunity is to complete some daily cards. So each day, Virgin Pulse will provide 2 daily cards, and those cards encompass information, tips, tricks around the 5 dimensions of well-being. So it'll include information that you can put into place right then and there, so useful tips on financial, physical, emotional, social, and spiritual. All you need to do, open up your cards, read through it, indicate that you've read it, and some of those are actually true-false questions. Don't worry, if you get it wrong, and occasionally I get those questions wrong, you'll still receive your points. So you're able to earn 40 points per day by completing your cards. 40 points a day times 30 days in a month is 1,200 points. For 3 months, for the quarter, that's 3,600 points. Pretty good start. The next up is tracking healthy habits. And you get 10 points for each habit that you track, and you can earn a total of 30 points per day. So you can track 3 habits and earn 30 points per day. 30 points a day multiplied by 30 days in a month, 900 points, and that's 2,700 points for the quarter. Next up is sleep. So you'll get 20 points per day for tracking your sleep. Your Max Buzz will do that for you. So all you need to do is wear your Max Buzz during the day, wear it to bed at night. When you upload your information, you'll earn 20 points for each day that you track sleep, that you wore it to bed. And if you've slept 7 hours or more, you'll get 50 additional points. So you'll get 70 points a day for tracking sleep. So if you track sleep 30 days a month times 20 points, that's 600 points a month or 1,800 per quarter. So if you just did those 3 habits, that's 8,100 points that you would earn during the quarter by doing things consistently and tracking stuff that you're likely already doing. Some additional ways to earn points and some additional ways to enhance wellness. First would be sleep. So with the HealthFlex program, you're able to select your sleep profile in the sleep guide. When you do that, you'll earn 250 points. Pretty good bonus there. And then, like that statement says, the Max Buzz automatically tracks your sleep. So when you upload your steps, you'll earn those points. Most activity trackers also track sleep. It's become fairly common to track sleep and activity because we now know that sleep is so important. So great way to earn points throughout the quarter. The nutrition guide is something that I really enjoy as well. You'll set your sleep or your nutrition profile. You'll pick what type of eater you want to be or what you want to reinforce. You'll earn 250 points per quarter. And then you're also able to browse recipes. So there's an enormous number of recipes that you can sort and sift and filter based on, is it vegan? Is it low sodium? Is it a weeknight dinner? Can I get this prepared in 30 minutes or less? That's important, right? When you get home from work and you're tired, it's like, what do I eat now? They have some very convenient, easy recipes that are tasty in that bank of recipes. There's also comments from participants in the program, and some of those are really, really insightful. They talk about maybe substituting one thing for another, and all the things that I've tried have actually made the recipe better. You can also track calories. In order to track calories, you'll need to use an app called MyFitnessPal. So I've been using MyFitnessPal for probably the last 6 years or so. I've been using the free version. The free version is enough. I haven't found a need to buy premium. The premium has a monthly subscription, and I'm not a fan of having a bunch of monthly subscriptions out there. So if you're interested in tracking calories and earning points for tracking calories, I would suggest using the MyFitnessPal app. And by all means, there's no need to buy up to the premium service. Rethink Care was formerly known as Will, and they offer some self-guided programs around resiliency, mindfulness, and even yoga that you can participate in each month. These are self-guided. Many of them are video-based, and you can actually, with the yoga, you can actually follow along with that person that's leading that yoga session. The Rethink Care sessions are typically 10 to 12 sessions long. You'll get 10 points for each session that you complete. I should say each series is about 10 sessions. And then the monthly bonuses. So you'll receive monthly bonuses for all those activities that I've talked about so far. That should really be in bold, and it should be flashing, because that is a terrific way to get bonuses. And I've mentioned this word before. It's consistency. We don't need perfection. You don't need to do something 30 times per month to get or 30 days in a row to get the bonus. You'll get bonuses, monthly bonuses, based on doing something 10 times or doing something 20 times. Not in a row, just those number of times. Some of those bonuses are pretty sizable, up to 500 points per bonus. That means that that habit that you're tracking, that habit that you're doing, is very impactful. So consider looking at those bonuses and working toward earning those each month. So now we talk about the biometric screening. Blueprint for Wellness, that's offered through Quest, and it offers or has 28 different tests included, from thyroid, liver, kidney, cholesterol, general inflammation, pancreas, so glucose, HbA1c. So these are tests that assess common health risks. All of those test results will get mailed to you in about 3 weeks in that document called My Guide to Health. It is a wonderful document that explains all of your test results, provides resources at no cost to you to help improve or maintain certain measurements. And there's actually a page in there. So I bring the whole My Guide to Health to my doctor when I see her each year. There's a page in back that's a summary page that I rip out and I hand to her. And if you've participated before, it'll show about 5 years worth of results, so they can get a great idea of what those trends look like. So I haven't had to have any additional blood work done once I brought in that My Guide to Health report. So definitely a wonderful resource and a time saver. Whoops. So there are 4 ways to complete the screening each year. The first is at a local Quest facility. And what you'll do is you'll use your Virgin Pulse app. You'll actually navigate to Virgin Pulse. You'll go to click the Benefits tab at the bottom of your app, and then scroll to find Quest. Click on Quest, and then you'll be able to schedule at a local patient service center. You'll see any available on-site screenings. This last year, we were fortunate to have the most plan sponsors and the most on-site screening events since before COVID. We hope that trend continues. So next March, April, you'll see all of those events loaded into the system so that when you go in and schedule, you'll be able to see where you can go on-site at your annual conference or other sponsored annual conference event. Another option is the physician form, and this works for a lot of people. So they would prefer to go have a conversation with their doctor, have their doctor draw the blood. The doctor would then fill out the physician form, so that's something that you'd print out from your Quest account, you'd bring with to your doctor. Doctor would complete it, and then your doctor can fax it into Quest, or my preference would be that your doctor hands it back to you so that you have it in hand, and then you can upload that into your Virgin Pulse account. You'd take a picture of it and then go back to Quest and then follow the steps to upload that. The next opportunity is the at-home test kit. This is a self-collection kit. This would require you to stick your finger and drop some blood onto a card. There's a really great set of instructions for participants to follow. You'll want to make sure that you follow those to the letter and then return that back in a timely manner. That kit, unfortunately, that opportunity isn't available to residents of New York State. Quest is working to get that option added for New York residents in the future. So the deadline to complete Blueprint for Wellness is coming up. It's August 31st. You could actually have a visit on August 31st at a doctor's office, and that will still count. A couple days after you complete your screening, you'll have $100 in Pulse Cash added to your Virgin Pulse account. Pulse Cash is money. It spends just like cash. To get to the location where you register, you would just open up your Virgin Pulse app, click Benefit tab down at the bottom, and then search for Quest. Click on that button, and then follow the steps. The other program that has a mid-year deadline is Health Check, and that deadline to complete it is also August 31st. This is an online health assessment that you'll complete. If you complete Blueprint for Wellness first, some of those test results will actually populate Health Check, thereby making it easier to complete Health Check. And Health Check you could typically get done in about 15 to 20 minutes, okay? This is a picture of the desktop. So from a web browser, you'll log in, click on Health. After clicking on Health, you'll select Surveys from the drop-down menu, and then you'll land on the Health Check homepage, and then just follow the steps to complete. If your spouse is also covered by HealthFlex, your spouse will also need to complete Health Check by August 31st to avoid the higher deductible for 2024. So you complete it this year to avoid the higher deductible for the following year, for 2024. So wellness credits are a wonderful opportunity to earn an additional $150 in Pulse Cash. So there's a variety of activities that you can do to complete or to reach 150 wellness credits. And I'm going to open up my app and I'm going to navigate there. So these activities, you'll have until December 31st to complete that. So there's still plenty of time, but don't wait, okay? You'll be able to open up your Virgin Pulse app, click on rewards, and then just scroll down, and you'll see every wellness credit earning opportunity. For example, when you complete Health Check, you'll earn 35 wellness credits. When you complete a journey, we haven't talked about journeys yet, you'll earn 15 wellness credits. Submit a success story, you'll earn 20 wellness credits. We love hearing about how these wellness programs are helping you with your well-being. If you increase your contribution to UMPIP by 1%, 15 wellness credits. You register or log in to Benefits Access, 25 wellness credits. So under that Rewards tab, you'll be able to scroll down and see all of those point earning opportunities. You'll also receive wellness credits for 7 of the measurements or 7 of the tests that are measured in Blueprint for Wellness. So if that test, one of those 7, is in the healthy range or desired range as part of the American Heart Association guidelines, you'll receive 20 points or 20 wellness credits. If you've improved it from the prior year, so let's say my BMI last year was 35. This year I complete my screening and my BMI was 34.9. Not a big difference, but it's a change, right? It's an improvement. Then that means I would receive 20 wellness credits for that improvement. So you can get it for improving last year's test results or for having test results in the desired range. And all of those are listed in your Virgin Pulse app. And that $150 in Pulse Cash is available for you annually, and you can earn that up to August 31st. I'm sorry, you can earn that up to December 31st. So lots of different ways to earn those credits. Here's another way to earn those wellness credits. So health coaching. Health coaching is available from January 1 through the end of the year. So it's a calendar-based program. And you're able to connect with a Virgin Pulse coach. Every coaching call that you complete, you'll earn 25 wellness credits. So in 6 calls, you will have reached 150 wellness credits. Definitely a great way to get there. And you could rest assured that the health coaches are certified. Many of them have graduate degrees. All of them have an undergraduate degree, at least in a health-related field. And they're providing evidence-based, empirical, great information, accurate, safe. If you go in and Google weight loss, you'll get everything under the sun, and it's difficult to ascertain what's safe and what will work and what's quality. That health coach is there to provide you, first off, with that great information. Some common coaching topics would include eating healthier, getting tobacco-free, managing weight, sleeping better, reducing stress, getting active. But they can also help you with chronic pain, anxiety, depression. So it's whole person coaching. It's really what you're interested in working on. And the coaching calls, they all take place via telephone. So it's a wonderful opportunity to connect with somebody who will support you in your well-being journey. Perfect segue to journeys. So journeys are also available January 1 through December 31st. These are multi-week, self-guided, self-paced courses. And you can scroll through the journey section. You get there by going to health, click on the health title in your app, and then click on journeys at the top, and you'll see an enormous number of opportunities for you. When we show this slide, it says sleeping better, reducing stress, eating healthy, reduce back pain. That's a big one. Getting more physically active. There's at least 4 or 5 journeys available for each of those topics. So under sleeping better, there's 5 journeys that are listed. You can find one that resonates with you. If you start it and you're not into it, you don't like it, you can always go to another journey. So there are probably 100 different journeys associated with all 5 dimensions of well-being and beyond. So it's a wonderful way to get easily consumable and applicable information to your regular everyday life. We talked a little bit about the nutrition guide. So this is what the nutrition guide actually looks like, and this person selected they want it to be an energized eater. So that basically just means you want to focus on food that's not going to weigh you down. So I typically do this one, and I can guarantee it doesn't include the meat skillet from the local diner, but it does offer excellent recipes and excellent tips so that I don't want to order that meat skillet from the local diner. Okay. When you select your profile, you'll earn that $250 or 250 levels points. So that'll get applied to your account. And then it'll also add trackers that help to support that profile. And then you're able to engage in those trackers in your app and work toward reinforcing those positive behaviors. The same thing, it works the same way for the sleep guide. The sleep guide has a couple extra steps in it, but you'll select your profile. And in this screenshot, there's 6 profiles to choose from. What I'm currently working on is keeping it going or quieting the mind. I've done both. I was quieting the mind Q2, and now I'm keeping it going for Q3. I mentioned my kids are home. My college-age kids are home. So I need some help in getting back to bed after they've woken me up. Just like with nutrition, when you select your profile, it'll place 3 habits in your healthy habit tracking section to reinforce that behavior. You'll also set a sleep goal, so you'll determine how many hours of sleep that you want to sleep. I've just set mine at 7, so it's on the low end of that spectrum of what we need. But great way to earn points and a great way to reinforce an important habit, daily habit for us. So chronic disease prevention program is offered through Omada. It's an online program. It's designed to reduce your risk of developing heart disease, diabetes, and get you to a healthy weight. So it does a bunch of different things, but we call it a chronic disease prevention program. It's interactive. There's weekly lessons for you to engage in and complete. There's also a professional coach that's available for support. And what I liked is that you're able to join a small group of participants. So it's kind of like there's some camaraderie in that group. So there's going to be a group when you join. You'll be placed in a group that's recently joined, and you're able to interact with them, share experiences, get support. Rest assured that you can participate anonymously. So you could put in your nickname. You don't need to put in your name. And you don't need to use your picture. You could use a picture. I've seen dogs, I've seen cats, I've seen plenty of beach pictures, vacation pictures that look like as your profile picture. But it's a wonderful way to get support from people who have found tips and tricks that are working for them. For both the chronic disease prevention and the diabetes program, which I'll talk about next, you'll need to answer a couple of questions to see if you qualify. So you'll navigate to benefits on your app. From there, scroll down, find Omada, click Omada, and then follow through with those questions to see if you qualify. The diabetes prevention program was just recently enhanced. It's now working for people with a diabetes diagnosis, so both type 1 diabetes and type 2. Your coaching comes from a more specialized coach. They're actually certified diabetes care and education specialists. And they're there to help you manage your diabetes to the best of your ability. And that includes lifestyle changes, behavioral changes, and also helping to manage that medication. So those coaches are skilled in helping you with those habits. And again, this is for people with a diagnosis of either type 1 or type 2 diabetes. So the EAP program, when we say EAP, that means Employee Assistance Program. And this encompasses a couple different benefits that we'll talk about. The first benefit that you get is confidential counseling. And the confidential counseling comes in or by way of either in person or telephonically, virtually. You're allowed up to 8 sessions at no cost per concern per year. This covers the household, so it covers the primary participant, the covered spouse, but if there are members of the family living in the house that aren't on HealthFlex, it still includes them. So it's a doorbell benefit. It includes everybody in the home, not a belly button benefit, which would mean participant and spouse. And I've actually used this service to help find some resources for my parents, my aging parents in suburban Detroit. To begin, you would just call that 800 number and then ask them for an authorization, an EAP authorization code. They'll give you that. You'll give that to the provider that they help you find. Some common topics: conflict resolution, maybe an impact of living with chronic disease or serious illness, maybe caring for an ailing family member. Another piece would be like stress, anxiety, depression, so entire spectrum of emotional health. And then we've got a couple of things kind of put in there that are a little different. So I mentioned I called the EAP to find some services for my parents. As I said, my parents live in suburban Detroit. You can call the EAP and ask for a resource specialist, and they can help you find child care or elder care. And what I did, I called to find some elder care services for my mom and dad. After a couple of days, they were able to give me a couple of providers, their phone numbers, their contact information, some background information, so that me and my family could sit down and figure out who we wanted to talk to, who out of those 3 we wanted to have take care of my parents or provide that service. So they can help you get to making a decision quicker. If we just Google elder care and a zip code, we'll get 1 billion hits. That doesn't get us any closer to making a decision. Probably gets you farther from making a decision, because when I did that, I was overwhelmed at being able to sift and navigate through that. So that EAP, they can help you find those resources. So it's getting to a decision quicker. Talkspace is a new ad. So we've had Talkspace for about 18 months or so. Talkspace is offered through the EAP. So you'd actually call the EAP phone number. And what you're able to do is set up sessions so that you can text with a therapist or have scheduled live video sessions. And 1 week worth of texting is equal to 1 EAP visit. So if you're going to text with that therapist, that's essentially 8 weeks worth of texting to come up to those 8 sessions. You're able to, you're going to message or text with them through their secure website or their app, so it's proprietary. And in order to set that up, you would just call that 800 number, ask for the Talkspace authorization code. They will then recommend or tell you to go to that website to set up your account. But it's a wonderful way to be able to engage in emotional support or emotional counseling without having to be tied to going to an office or a specific set appointment. So we hope that you would consider that should the need arise. MD Live has been around with us for a while. So MD Live, we've had MD Live as a physician line. So if you have a rash, or your child has a rash or a cold or a sore throat, you're able to call that physician line and get seen by a doctor for a non-emergency related health concern. Well, recently we've added the behavioral health aspect to that, and that behavioral health also includes psychiatry, so they can manage medicines and prescribe medicines. Another key feature is the MD Live behavioral health component is able to get you a visit with a therapist in about 7 business days and about 14 business days for a psychiatrist, which I'm told is a lot quicker than what typically happens if you were to go through your primary care physician or your medical group. So you're going to be able to get easy access to somebody to help you. Then you're able to talk to them via phone or video. There's no text with MD Live Behavioral Health, but it offers a terrific opportunity to be able to get that type of support. So Weight Watchers, I think everybody knows Weight Watchers. It's a tried and true program. A lot of people have been very successful using it. As part of the HealthFlex program, you're able to join that at a discounted price. So there's 2 options. The first option is just the online or digital only, and there you'll set up an account and you'll have all the recipes and all the great tips and tools and tricks and curriculum that you'll get with Weight Watchers. That's $848 per month. The next opportunity is the digital experience plus the workshops. The workshops are what they're calling the local weekly meetings. So you're still able to sit with a group of folks and get support and get that full experience. And that's $19.11 per month. So let's summarize the well-being incentives. So participants and spouses covered by HealthFlex can earn up to $410 per month, or per year. Per month would be too much. But $410 per year in Pulse Cash. That's up to $160 a year for reaching level 4 in all 4 quarters of Virgin Pulse. And with those tips, I'm hoping that we're going to see a shift in folks going from finishing the quarter out at level 1 or finishing the quarter out at level 2 and getting to level 3 and level 4. I tell you, it is possible. I can get to level 4, so can my spouse. You can as well. And then, so Blueprint for Wellness, complete that by August 31st. You'll get $100 in Pulse Cash placed in your account shortly after you complete the screening. You'll also earn $150 in Pulse Cash for completing those 150 wellness credits. Go in and check your account. You might already be earning wellness credits. If you've logged into Benefits Access, if you changed a beneficiary, if you've had a conversation with EY, if you've completed Blueprint for Wellness already, you're likely already earning wellness credits. So please, in the next couple of days, just go in, check to see where you're at, and then let's make a plan to see if we can get you to complete those 150 points by December 31st. The health check, the due date for health check is August 31st also. And completing that, you'll avoid the higher deductible for next year, for 2024. And to be clear, that's the medical insurance or health insurance deductible. So you'll avoid the higher deductible for next year. If you're married and your spouse is also covered by HealthFlex, your spouse will need to complete that by August 31st as well. So a shortcut here, you can scan that QR code with your phone and it'll take you to that Linktree link right there. And what you'll find are a bunch of short videos that demonstrate how each of those programs look and how they're used on that Virgin Pulse app. So a terrific resource right there. So some key takeaways. So whether you're trying to increase your physical activity, improve your sleep, or focus on your emotional well-being, Virgin Pulse and HealthFlex well-being programs can help you reach your personal well-being goals. Not only can you avoid a higher deductible in 2024 by completing Health Check, but you can earn $100 in Pulse Cash by completing Blueprint for Wellness, also by August 31st. And this means that you're starting your wellness journey on the right foot by assessing your health status and your risk. There are a variety of ways to earn, whether you are tracking healthy habits for Pulse points, meeting with a Virgin Pulse health coach for wellness credits, or completing the Blueprint for Wellness and earning that $100 in Pulse Cash. You and your spouse, if covered by HealthFlex, can each earn up to $110 annually. Don't miss out and reach your well-being goals today. So let's take a look. Looks like we have a number of questions. We've got a couple of... Oh, I just saw one. That's easy to answer. I'm going to pull up this. So yes, there are gluten-free. There are gluten-free recipes available on that the Virgin Pulse account. So where is it located? And this would be the nutrition guide. So with your phone, open up the app and then click Health. When you click Health, you'll see some titles across the top. You'll be able to click on Nutrition Guide. And then from there, you could set your profile, but as you scroll down on that, you'll be able to see where it says, it'll say Energized Eater Recipe Collection. So those are the collection based on my profile, right? I told you guys I was the Energized Eater. All you need to do is click Read More, and it'll take you to the recipe section. And then from there, you're able to sort by gluten-free. So that is great. We got those two. I ordered a Max Buzz in January and haven't been able to get it to work. Is there anything I can do to return or get a credit back? Yes, I would encourage you to contact Virgin Pulse and then let them know that you weren't able to get it to link. Occasionally that happens, not frequently, but occasionally. They typically have a 12-month warranty, and they can also help you get that connected. Those the Max Buzz actually have software in them that run, and occasionally they just need an update. They need to get reset. So if you call 800-830-4312, you can talk to a customer service person at Virgin Pulse, and they can help you reset that device and then get it connected. And if it's not working, and if you've purchased it within 12 months, they should provide a warranty replacement. If I haven't been enrolled in a few years, am I eligible for the credit for Fitbit or Apple Watch? It's possible. That credit should be there until you use it. So if you log into your Virgin Pulse account and then maneuver to the store, so you'll log into Virgin Pulse, so open up your app, and then at the bottom right-hand corner, click More. It's those three little dots. Then you're able to click Store. Go through the purchase process, and toward the end, you'll be able to see if there's a credit for you. And potentially you won't have to enter your credit card information if that credit is still there. So it should be there. It should be there until you use it. So I'm a minimalist when it comes to technology. I use what I have to and no more than that. Virgin Pulse is a heavily app dependent. Is there consideration in the future? You know, this is something that we hear occasionally as well, and I completely understand where you're coming from. Unfortunately, that's kind of where most things are going, is technology. So that app, so the Virgin Pulse app, if you're using the Virgin Pulse app and Max Buzz, that's really all the technology that you'd need to use to engage in that program and to be able to earn all those points that we talked about. Complete your daily habits every day, complete your daily cards every day, track sleep every day. Those numbers really add up. Tracking my daily habits, I am asked to connect with a coach, which I have already. I have an appointment coming up. That will keep popping up. That is just a prompt. There might be an opportunity to be able to dismiss that prompt, but that's a typical habit within the app, is to kind of promote another thing that you might find useful. Yes, the EAP and the MD Live, well, the EAP provides 8 sessions at no cost. You're able to get more sessions than that from MD Live. The EAP authorization code, they will give that to you when you call them. So you'll call that EAP 800 number, and they'll give you that authorization code as part of kind of getting you started. And then they can actually search for you or help you find a counselor, or you could search yourself online from your app. You would just navigate to Optum EAP and then click on that, and then that page it'll bring you to is where you can actually search for a provider by zip code. So when you call in, they could search for a provider by zip code, or you can also search yourself for that provider zip code. What if I already have a device? Can you connect into VP? So if you already have a device, so like I use a Fitbit, but I still have a Max Buzz. So my Fitbit is my everyday quarterback. My Max Buzz is my backup quarterback. My Max Buzz is on the bench. So if my Fitbit has a glitch or a problem, and it has, I can always then just put on my Max Buzz. So you can have more than one device connected to your Fitbit. Connected to your Virgin Pulse account. Like I have my Max Buzz, I have my Fitbit, and I have a polar heart rate monitor connected to my Max account, or my Virgin Pulse account. And it's not cheating. I'm only going to get points. I'll get points associated with the highest upload. So if I have, 20,000 steps on my polar heart rate monitor, let's say I wasn't wearing my Fitbit or my Max Buzz. Let's say I wore my Fitbit half the day, so that's 10,000 steps. And my Max Buzz has 3,000 steps. I'm not going to upload the cumulative amount, or I won't be rewarded on the cumulative amount. I'll be rewarded on the highest amount. So that was the 20,000 steps. So that means I would get 140 points for that, for the first 14,000 steps I uploaded. So you can have more than one device. You can also link your Apple Health app and the Samsung Health app to your Virgin Pulse account. The only concern there is that means that in order to get max points for your steps, you'll need to bring your phone everywhere. and I know not everybody is interested in doing that. I like to leave my phone home for certain activities. So you've registered for EY Navigate. Yes, thank you. That's awesome. And you have met with a financial planner. When will the credits show up? Excellent question. These take a little while because we're working with outside vendors. So if you meet with a EY Navigate coach or you register for EY Navigate in July, you should appear on that August file. So that file is then sent from EY to Virgin Pulse on a monthly basis. So it's possible you might have to wait 6 weeks based on if you went in the beginning of July. You won't appear until that August participation file, okay? Or the July file is delivered by mid-August. So it does take a little while. Same thing if you update your beneficiaries. That one takes a little while too, but those are two important things that we need to keep doing, right? Making sure that we're squared away. Go ahead. The Saving Grace, I think the Saving Grace program is actually self-report. So some of those wellness credit earning opportunities are self-report. So what that means is you'll navigate there, you'll click on it, open it up, and there's a form that you're acknowledging that you've completed the program or you've done the activity, right? So it's on your honor, and you'll go ahead and submit that and get your points. So at the end of each quarter, do your rewards or Pulse Cash stay there? Yes, that's a great question. So your Pulse Cash can build up over time, so it no longer expires. So if I have anybody on the call, the webinar that was a legacy person like myself, I've been involved in the program for 10 years, 11 years. Pulse Cash used to expire. The great news is, as of a couple of years, it no longer expires. Okay, it used to expire after 2 years. Now it doesn't expire. So you can actually save up for bigger ticket items. And believe it or not, I met a clergy person this last spring in Philadelphia who showed me the MacBook that he bought with his Pulse Cash, and he showed me his Apple Watch that he bought with his Pulse Cash. So yes, that can add up, and you can use that as a bank account. There's no interest, but you can use it as your bank account and tap into it as needed. Should you terminate, you'll want to make sure that you transfer out that Pulse Cash within 30 days of terminating, of canceling the program. But that's the only way that it expires. If your spouse is the employee, you are on VP but not an employee, how can you get credit for logging into Wespath benefits? That is true, and that should say that that's an employee or a primary participant benefit, but you're still able to earn wellness credits for the other activities like journeys, health coaching, the BFW, Blueprint for Wellness screening results. So still a lot of ways to do that. We are coming right up on time. Let's see if we can get one more. These are all great questions. Thank you so much. These questions make me more interesting. Who do you call if your Fitbit is not recording sleep or recording incorrectly? I would contact Fitbit. They might be able to walk you through a reset. You know, these little things on our wrist are fairly complicated, and occasionally they do have a bad day or a bad couple of days. So I would suggest calling the customer service at Fitbit. I've had good experience working with them as well. I've used a Fitbit for quite a while, and they've been able to help me navigate and reset some things. So that is about it. If I haven't gotten to your question, I will answer it in an email within a couple of days. Thank you so much for participating in today's webinar. Thank you for your questions. Have a wonderful day.